In today's lecture, we'll study one of the most important structures of the upper respiratory and digestive systems, the pharynx. By the end of this lesson, you will understand its anatomy, anatomical divisions, muscles, blood supply, nerve supply, physiology of swallowing, and the clinical importance of this fascinating organ. So let's begin. The pharynx is a funnel-shaped fibromuscular tube situated behind the nasal and oral cavities. It begins at the base of the skull and extends inferiorly to the level of the sixth cervical vertebra, where it continues as the esophagus. In adults, it measures approximately 12 to 14 centimeters in length. One of its unique characteristics is that it serves as a common pathway for both the respiratory and the digestive systems. Air passes through the pharynx on its way to the lungs, while food passes through it on its journey to the stomach. The pharynx is divided into three anatomical regions: nasopharynx, oropharynx, and laryngopharynx. So the first division, the nasopharynx, lies directly behind the nasal cavity and extends from the base of the skull to the soft palate. Its primary role is respiration. Important structures found here include the pharyngeal tonsil, commonly called the adenoids, and the openings of the auditory or eustachian tubes, which help equalize pressure within the middle ear. The second division is the oropharynx, which lies behind the oral cavity. It extends from the soft palate to the upper border of the epiglottis. Unlike the nasopharynx, it conducts both air and food. This region contains the palatine tonsils, the base of the tongue, and the lingual tonsils, making it an important component of the body's immune defense. The third division is the laryngopharynx, also known as the hypopharynx. This region extends from the epiglottis to the sixth cervical vertebra. It lies behind the larynx and continues as the esophagus. Its major function is directing food into the esophagus while allowing air to enter the larynx. The wall of the pharynx consists of four layers. The innermost layer is the mucosa. Outside this lies the pharyngobasilar fascia, which provides structural support. Next comes the muscular layer responsible for swallowing. Finally, the outermost layer is the buccopharyngeal fascia. These layers work together to maintain both flexibility and strength during breathing and swallowing. The muscles of the pharynx are divided into circular and longitudinal groups. The circular muscle includes the superior, middle, and inferior constrictors. Their coordinated contraction propels the food bolus downward during swallowing. The longitudinal muscles include the stylopharyngeus, salpingopharyngeus, and palatopharyngeus. These muscles elevate and shorten the pharynx during swallowing, making food passage smoother and safer. The arterial blood supply comes mainly from branches of the external carotid artery. These include the ascending pharyngeal artery, facial artery, lingual artery, and maxillary artery. Venous drainage occurs through the pharyngeal venous plexus into the internal jugular vein. The motor nerve supply is mainly through the pharyngeal plexus, formed predominantly by the vagus nerve. An important exception is the stylopharyngeus muscle, which receives its motor supply from the glossopharyngeal nerve. Sensory innervation differs according to the anatomical region. The nasopharynx is supplied by the maxillary division of the trigeminal nerve. The oropharynx receives sensory fibers from the glossopharyngeal nerve, whereas the laryngopharynx is supplied mainly by the vagus nerve. Lymph from the pharynx drains mainly into the retropharyngeal and deep cervical lymph nodes. Understanding these pathways is clinically important because infections and malignant tumors often spread through these lymphatic channels. The pharynx performs several essential physiological functions. It serves as a passage for air during breathing. It transports food from the mouth to the esophagus. It contributes to speech by acting as a resonating chamber that modifies the quality of the voice. It also provides immune protection through the tonsillar tissue, which forms part of the body's first line of defense against pathogens. Swallowing occurs in three coordinated phases. The first is the oral phase, which is voluntary. Here the tongue forms a food bolus and pushes it toward the pharynx. The second is the pharyngeal phase, an involuntary reflex. The soft palate elevates to close the nasopharynx. The epiglottis folds backward to protect the airway. The pharyngeal constrictor muscles then propel the bolus into the esophagus. The third is the esophageal phase, during which peristaltic waves transport food into the stomach. Several common clinical conditions affect the pharynx. These include pharyngitis, tonsillitis, adenoid hypertrophy, obstructive sleep apnea, dysphagia, peritonsillar abscesses, and pharyngeal cancers. A solid understanding of pharyngeal anatomy enables healthcare professionals to diagnose and manage these conditions effectively. Let's quickly review. The pharynx is a fibromuscular tube shared by the respiratory and digestive systems. It consists of three anatomical divisions: the nasopharynx, oropharynx, and laryngopharynx. Its coordinated muscles, blood supply, nerves, and lymphatics allow it to perform essential functions in breathing, swallowing, speech, and immunity. Mastering these concepts provide a strong foundation for understanding head and neck anatomy as well as many clinical disorders. Thank you for watching this lecture. If you found it helpful, please like this video, subscribe to my channel, and share it with your classmates and colleagues. Don't forget to click the notification bell so you never miss our upcoming lectures on anatomy, physiology, and clinical medicine.